thing that we rank in healthcare in this country is number one is in our spending. We spend 2 to 3 times more per person each year on healthcare than the other advanced nations do, and those nations actually cover pretty much everybody within their borders is guaranteed that they can get the health care that they need. Here in this country, we leave at least, well, now we're estimating around 50 million people who have no health insurance at all. But there's another similar or higher number of people in this country who are underinsured, and actually, if they have a serious illness, face financial ruin. The leading cause of bankruptcy in this nation is medical debt. 62% of all bankruptcies are due to medical debt, and 80% of those people who encountered medical bankruptcy had health insurance at the onset of their illness. So health insurance is not protective in this country. It's also the number one cause of foreclosures. So why don't we have real health care reform? Well, those very industries that are profiting off of the status quo or the way things are the ones who are making these campaign contributions to our legislators. And so we saw an increase of from over the last decade, the health industries increased their political contributions by about 73%. So about $373 million dollars were donated to our members of Congress from the health industries over the past 10 years. And half of those contributions went to the people who are chairs of the relevant committees or members of those committees. It doesn't matter what the party is. If the Republicans are in power, the money goes to the Republicans. If the Democrats are in power, it goes to the Democrats. I think it's pretty fair to say that there's really no tangible difference between the two major parties in this country anymore. They're both bought off by the corporations. This past year, what that money bought them is access. And so if you look at this whole health reform process from the very beginning, the insurance companies and the pharmaceutical companies and hospital administrators were at the table. We saw that back in March of 2009 at the first White House forum, when we wanted to have one single payer advocate invited to be part of that discussion. We had to threaten to have doctors outside of the White House picketing in order to get one person. Well, we got 2 people in, Chairman John Conyers and also Dr. Oliver Fine, who's the president of our organization. They weren't allowed to speak. The whole summit was opened up with the health insurance industry lobbyists, and it was closed with the health insurance industry lobbyists. And then again, we saw that as we got into the process of actually bringing the legislation into the committees, we worked as a coalition with a number of other organizations through something called the Leadership Conference for Guaranteed Health Care, which was Physicians for National Health Program, California Nurses Association, Healthcare Now. And we met with members and said, let's just have a debate. Would you just invite, some of our experts to come and testify, and let's make this a real discussion about what's best. And as they moved into the committees, the first committee to take up the reform was the Senate Finance Committee, chaired by Max Baucus, who receives about 80% of his campaign dollars from outside of the state of Montana. He's one of the highest paid by the special interest. They call him the darling of K Street, which is where the lobbyists are. We asked for one person to be part of the hearings that they were having, and they said no. And so many of you may know that 8 of us went down to one of the hearings, the second hearing, after being excluded, and after having thousands of emails and phone calls going into that committee from constituents asking to have one representative of the 41 be a single payer advocate. We went down there and had to stand up and speak out and say, why weren't we at the table? You have pharma at the table, you have the CEO of Blue Cross at the table, the Business Roundtable, why aren't we there? And they arrested us. What that did get us is I was invited to testify at the second committee, which was the Health, Education, Labor, and Pension Committee, because Senator Kennedy was alive at that point and his staff reached out to us. And I sat at the table right next to Ron Williams, who's the CEO of Aetna. He makes $24 million a year. And what was really interesting is as everybody was getting ready to start and we were sitting down and the senators were coming in, they all knew him by name. It was like, hey Ron, how you doing? So that just kind of gives you an idea of the amount of access that they have. We know that the health insurers were spending about $1.4 million a day this past year on lobbying. That works out to about $2,600 per member of Congress per day on lobbying. And it definitely got them what they wanted. This legislation was written by and for the industry. The woman who oversaw the process in the Senate Finance Committee, Liz Fowler, worked for Senator Baucus, left that and went and worked for WellPoint, one of the largest insurers in our country, as Senior Vice President of Public Policy, and then left that position to come back to work for Senator Baucus for this health reform process. And her name is on, she wrote the white paper, her name is on the legislation that was written. And no surprise that the Senate Finance Bill was the one that had everything that the industry wanted, and that ended up being kind of the real framework for what was passed. The other stuff was really smoke and mirrors, the talk about public option and all those other things. They were never actually meant to be in the final legislation, and of course they weren't in the final legislation. So this legislation that's been passed moves our country further in the direction of privatizing the finance of our health care. It's mandating that people purchase private insurance with no guarantee that they're going to be able to then use that insurance to get the care that they need when they get sick. There's no caps on premiums. We're using $447 billion of our tax money going directly to the private corporations to subsidize the purchase of their defective products. And though you hear a lot of spin saying that they're going to, now they have to take everybody with pre-existing conditions, they can still refuse to cover services. They can still limit their network so that people can't get to the doctors that they need to get to for their conditions. So they have a lot of ways to run around. This whole legislation was really full of loopholes for ways for them to get around that. So unfortunately, this took us in farther away from the directions that we'd like to go. It's going to be important for people to realize that, to not buy into the spin that this is going to be universal. It's not universal. They've already admitted that it's going to leave 23 million out. We estimate it will be higher than that. We estimate we'll have a higher population of underinsured people who are susceptible to financial ruin when they get sick in this country. And so we're actively organizing to build that movement. We've had a great movement over this past year. It just was really under the radar because the mainstream media is also heavily influenced by their corporate dollars, as we learned as we tried to get attention over the year for the events that we were doing. But there was a huge amount of activity and groundswell that was happening under the radar, and it will continue to happen and grow. And really, there were three things that we learned that I'd like to share with you over this past year. Three things that are really important. I think number one is don't compromise. In this country, we're so used to getting nothing that we'll take anything. With other European nations, they look at what we have here in terms of, employment support and benefits, and they would just laugh at what we're happy to get. So we got 12 weeks of unpaid leave. Whoopee! They get 30 weeks of paid leave. So we've got to stop compromising. We've got to say, no, this is what we need in order to make our country healthy and productive and functioning. The second thing is that we need clarity. It's really important that we're educated and we know exactly what we're asking for, because if you don't know exactly what you're asking for, they're going to sell you something and tell you that it's what you're getting. So they'll say, well, this is universal, or this is affordable, or this is guaranteed health care. If you don't know enough to recognize that it's not any of those things, you're going to buy into it like so many people have done, unfortunately. And the third thing is that we have to remember what our role is. Movements are not political parties. We are independent movements. And so it's important that we remember that our role is to push the members of the legislators, not to give in and say, well, I really like this person, so I'm going to let him vote for this legislation that doesn't work because I want him to stay in office or her to stay in office. No, our role is to be the people, is to push on them and tell them what we want, and then they respond or they don't respond, and if they don't respond, they need to hear from us that we're not happy about that, or we need to be out there on the streets organizing. So I really applaud the work that you're doing. I thank you very much for inviting me to be down here tonight to be part of this. And I encourage our movements to work together. I think that we all have a common force that we're trying to overcome. We need to shift the power away from the corporations back into the hands of the people. And so we can work together and recognize that commonality. And I think that hopefully we'll get there. Thanks.